Hello class, my name is Elizabeth Shewmake and today is July 18th, 2022. I will be presenting my pathology presentation over Marfan syndrome. First, I'd like to start with a few facts about Marfan syndrome. According to the National Library of Medicine, it is one of the most common inherited disorders affecting connective tissue. 1 in every 3,000 persons are diagnosed with this disorder. So chances are you've probably seen or been in contact with someone diagnosed with Marfan syndrome. Marfan syndrome also spans over a broad range of severity. Cases can range from isolated features to severe and rapidly progressive. Next, I'll explain what Marfan syndrome is and how it comes about. According to an article within the website Mayo Clinic, Marfan syndrome is caused by a mutation of the FBN1 gene. This gene tells your body to produce a protein that helps give connective tissue strength and elasticity. In most cases, the abnormal gene is inherited from a parent who has this disorder. This means that if a parent has it, there's a 50-50 chance that the child will inherit this disorder. The inherited gene accounts for 3 out of every 4 people who are diagnosed with Marfan syndrome. The other 1 out of 4, the mutation cause is unknown. So overall, it affects everyone equally except those with an affected parent. Marfan syndrome can present in both physical and internal symptoms, depending on the severity of the case. On the Mayo Clinic website, it's stated that some physical symptoms of Marfan syndrome include a tall, slender build, disproportionately long arms, legs, and fingers, a breastbone that protrudes in or out, a high-arched palate and crowded teeth, extreme nearsightedness, abnormally curved spine, and flat feet. The internal symptoms include heart murmurs, cardiovascular system problems such as weakening of the aorta wall, which can cause an aneurysm, and dissection or valve malformations. Marfan syndrome can also cause lens dislocation, retinal problems, early onset glaucoma or cataracts, and it can also lead to skeletal issues like scoliosis and rib abnormality. Lastly, Marfan syndrome can be diagnosed through many different tests. According to an article on the Cleveland Clinic website, these include chest x-ray, ECG, echo, TEE, MRI, CT, and blood test. There's no cure for Marfan syndrome, but you can treat some of the symptoms. Treatment includes medication to prevent or control complications, beta blockers to relax the heart, angiotensin receptor to regulate high blood and heart failure. Surgery can be required in some cases to prevent the aorta from dissecting or rupturing. Requiring surgery is based on the size of the aorta, the aortic growth, age, height, sex, and family history. There's 2 types of surgeries performed in these special cases. The traditional method, where the aorta is replaced with a graft and the valve is replaced with a mechanical valve. And the second surgery option is the valve-sparing method, where the aorta is replaced with a tube graft and your own valve is put back in. In conclusion, Marfan syndrome can affect your entire body, including your skeletal system, heart, blood vessels, eyes, skin, and organs. It ranges in severity, and there's no cure, only treatment for the symptoms. Thank you.